Thank you all for coming. This is our very first webinar for One You Lincolnshire. I'm just going to introduce you to a couple of people, my little team. We have got Chelsea McCarthy. Give us a little wave, Chelsea.
Hello, everyone.
Chelsea, you may know Chelsea. She leads on relationship building in the West locality of Lincolnshire. So do drop her a message if you'd like to chat to something West locality related. We've got Nicola, who leads on relationship building in the East locality. And Steph, who has popped into the chat already, who leads on the South and Southwest. She also covers that Boston area as well. So you're going to hear from each one of us in turn throughout the course of this webinar. Please do pop your questions in the chat. We'd really love that. And if you've got any questions that you'd like to ask us kind of right at the end, please hang around. We're going to be staying in this chat and we can take some questions later on as well. Gosh, we're creeping up now to the mid-40s, which is brilliant. Thanks for that. So shall we get rolling with the presentation?
Yep.
So here we are. Welcome, as I said earlier. So who are we? So we are One You Lincolnshire. We are an integrated health and lifestyle service, and we're commissioned by Lincolnshire County Council and indeed the CCG. What we mean by the word integrated is that you as healthcare professionals can make one referral for patients or clients to access all of our pathways if they're eligible. We're very lucky, One You Lincolnshire, there's a team of 35 of us, and we're all very proud to work for Thrive Tribe. Thrive Tribe have developed a really strong track record in developing healthy lifestyle provision across England. So you may recognise some of the offers we have for you in Lincolnshire here, and indeed some of our lovely colleagues are here today. Thank you, Fionn, for joining us, who will be chatting later. So what do we do and who do we work with? So we can support Lincolnshire residents lead healthier lifestyles through helping them to stop smoking tobacco, to lose some weight, to move more, and to drink less alcohol. So as a team of referral generation officers, we do this lots of different ways. One of the key focuses for today's webinar is about how we further develop the relationship with primary and secondary care. So how we work with primary care, and we can recognise a lot of primary care colleagues in the room today, so thank you for joining us. We deliver virtual meetings. Chelsea has literally just finished one with Cliff House Medical Centre. And what we do in those meetings is really ensure we've got really strong relationships with primary healthcare so that they can refer their more complex and patients with long-term health conditions through to One You Lincolnshire. You may or may not be aware we've had a recent relaxation in our criteria, which means that people can self-refer into One You Lincolnshire, which is brilliant. But what we really want to do is make sure you as clinicians and healthcare professionals still have access to that provision for your more complex clients. You'll get from us lots of newsletters, hopefully not too many, you get one a month. You also get some monthly updates where we share with you data to do with referrals into One You Lincolnshire in any given month. We also have resources, and we work with surgeries to help them send out text messages using System 1 or EMIS Web or MJOG, whatever it is you use. Thanks, Nick. The relationships we build with secondary care are in all the hospital bases across Lincolnshire. We also work with the respiratory and the diabetes team and cardiac rehab team. So if you're from secondary care and you're here today and you'd like to develop a bit more of a relationship with us in terms of onward referring your patients, please do get in touch. And we're delighted to have some colleagues here as well from social prescribing, from VCS. We also have some very strong relationships with Carers First, wellbeing links as well. Again, we're looking to form those same relationships with you as well as part of the holistic nature of our service. Thank you, Nicola.
Thank you. Okay, so we're going to just talk through the 4 pathways today. For some of you, this will be a bit of a recap, and for others, it will be a bit of an introduction. So if you do want to hear more about any of these pathways, then please do get in touch with us, and we're happy to do a meeting with you. So our 4 pathways, as Ali said, are be smoke free, move more, drink less, and lose weight. The first of these pathways is our stop smoking pathway. So we run the stop smoking support for the whole of Lincolnshire. So anyone who's trying to stop smoking, please send them through to us. So this has always been a self-referral route, and even when we're out of the pandemic season, it will continue to be a self-referral route. So people come into us and they work with us for 12 weeks with a One You Lincolnshire practitioner or with a local pharmacy or GP, so someone who we have trained, or they can go through our 28 days phone service, which Fionn will be talking about in a moment. So we offer one-to-one support through phone calls and virtual sessions, and we provide the nicotine replacement therapies to the patient's home, so they're posted out. And the medications such as Champix or Zyban, we request through prescription. We work with anyone who is currently smoking tobacco products over the age of 12. So I'll just hand you over now to who's going to talk to you a bit more about our 28 days phone service.
Hi, thanks for that. I've been threatened by Alison to get cut off if I take too long, so I'll try and be as brief as possible and straight to the point. So 28 Days Quitter are a stop smoking team that sit within Thrive Tribe, so the same organisation as One You Lincolnshire. And it's in the interest of increasing the flexibility of the provision that's offered to the clients and the residents of One You Lincolnshire. We developed our team with a few specific goals in mind and some unique aspects. The first one was that we were going to be completely remote, so we do everything over the phone, which isn't such a unique aspect these days. However, we're still holding on to it, and we're still flying the flag for that. Nonetheless, we do have some other aspects to our service that make us unique. We have a good out of hours provision, which works very well for people who are in demanding work routines or any other demanding routine for that matter. Out of the 6 days that we deliver across the week, 4 of those are run from 8 in the morning to 8 in the evening. And then moving forwards from that, we also do what we call a relapse sensitive model. What that means is that we support people on their quit date, just before their quit date and just after their quit date, depending on their availability. Can I just very quickly check, have I still got everyone in here? I feel like I've been placed into another room. Yeah? Yeah,
no, you're still there.
Okay, that's cool. I had a weird sensation there for a minute. It went really quiet and I thought, oh, okay, that's fine.
No,
so yeah, moving back to the relapse sensitive model, the idea behind that was to increase retention of our clients and also the quit rates. So ultimately, the outcomes that we get from our service and our provision is increased by supporting people just before, on, or just after their quit date, as well as the 12-week behavioural support that the One You Lincolnshire Stop Smoking team would do. As you can see on the screen there, there's a blue graph and a white graph. The blue graph shows the dropout of 100 smokers from day 0, setting their quit date, moving forwards into the future. As you can see, there's a really steep drop-off around day 7. And then the white graph shows once an intervention of multiple counselling sessions are placed in, especially around the quit date, and you can see how the curve is less severe and we retain a lot more of our clients. In real terms, what this means for Lincolnshire clients is that in Q2 just gone by, we achieved 65% quit rate, and that's well above the national average. Yes, it was very good, and we see that quite consistently, hovering around that 62 to 65 mark, which we're really happy with. I should mention that our criteria for clients is the same as One You Lincolnshire. Apart from the unique elements that I've just mentioned, our delivery is the same, and most of the referrals happen internally. So we're there to increase that flexibility in the offering that the One You Lincolnshire Stop Smoking service has. Thanks, Nicola.
Brilliant, thank you. Okay, so we're going to go over to Chelsea now, who's going to tell you a little bit more about our Lose Weight With service.
Brilliant, thanks Nicola. So our Eat Well and Lose Weight provision for One You Lincolnshire has 4 main elements of support. We're here to help Lincolnshire residents who have a BMI of over 30. If they're from a BMI group, that's 27.5, and we can accept them into our service here. So the first one in part of Eat Well and Lose Weight is our own group programme. This is a 12-week weight management course. It's on the same day, same time of each week, and it's a 90-minute day. So the first 60 minutes is about nutritional education. So we want to teach people the right things around nutrition so that they can successfully take part in the programme and therefore thereafter to adopt their lifestyle as a change, really. So the first 60 minutes is that education, and the last 30 minutes is light activity. So the nutrition education and the light activity, they come hand in hand for somebody to lose weight. Before the pandemic, this was delivered in local leisure centres, and whilst the programme was being delivered, the client had access to that leisure centre free of charge. So anything from your classes to the pool and the gym and so on. Because of the pandemic and our delivery has changed to remote delivery, we're now delivering this over Zoom. So it'll be a virtual platform, and again, you still get the light activity in the education side. It's just where that gym pass isn't available at the moment. So Man v Fat Football, this is a very unique weight management programme in the sense that it's based entirely around a football league, and it's also for males only. So we can give access for 14 weeks to the football league, and what happens is each week they will play a game of football, and that competitive nature within males in the football league, and they'll work their way up the football league by playing a traditional game of football, but they can also essentially score goals off the pitch. So they'll get set weight management tasks in which they will score a goal for each one completed successfully, and they can work their way up the league that way on the pitch and off the pitch as well. At the moment, because we're now into our second lockdown and outdoor sports has been affected by that, we aren't currently running the leagues. But as the last lockdown ended, we was able to very quickly get these up and running again. So once we get news of these up and running, we will send that out through our communications and our social media platform. So Slimming World and Weight Watchers, they're very popular. I'm sure you've all heard of those groups. We can offer a 12-week voucher for either one of those groups there. With them being an external provider, we wanted to get these on board. With Lincolnshire being quite a large rural county, we know that they're quite well populated in some of the village and rural areas. So it's, free 12-week vouchers for those groups there. And then our final offering is Second Nature, again, who are another external provider. These are a digital programme, so there's been no effect, so no change to the way that they're running. Will continue to be digital after the pandemic as well. And what happens is the client will get sent a health box, And in that health box, it will include a set of digital scales, a fitness tracker, a book that details the programme, and they'll get access to the app there as well. Now on the app, they will get support from a health coach, and they'll also get put into group support as well. And essentially they follow the programme using the app, the digital scales and the fitness tracker. So for somebody to come onto this programme, they'd need to be quite tech savvy. We like to save this one for some of our rural clients who can't get to some of the offerings there as well. Thank you. Thanks for that, Nick.
So the Move More pathway, so this is for adults, so 18 plus, who are currently undertaking less than 150 minutes of moderate activity a week. Now, we do have several different options, which I'll just quickly run through now. So we've got up to 6 one-on-one sessions with one of our own physical activity instructors, which is currently running via Zoom due to the pandemic. Now, this is more for people who perhaps have low mobility or haven't exercised in a long time. So the exercise tends to be quite low impact and even chair-based exercises. The man you see there is one of our clients called Terry, and it was really nice. He's got socks because when he came to us, he couldn't bend over to put his socks on. And so he said, if he got the activity up, we'd buy him some One You Lincolnshire socks, which we did. And he was very sweet, so included him. So the next one is the group online sessions, again run by our own physical activity instructors. So this is for people who maybe might be a little bit more able, or who already do a little bit of exercise, but our aim would be to try and push them up to that 150 minutes a week. Now, as you can see, it varies in sort of mobility, it varies in ability as well. So we really do kind of cater to the client themselves. Our next offering is exercise on prescription. So this is a 12-week structured programme, and it's the more traditional going into a leisure centre or a gym and working out there. And you can see the list of leisure centres that we do work with. I must stress, as it says, it's not currently available, obviously, because everything's shut at present with COVID, but as soon as we get the green light, we will let everyone know that that's an option again. From the outbreak, we have developed an online platform called the Other Room Gym. Now, this has live streamed daily exercise classes, again, different mobility and ability levels, depending on the room you go into. So as you can see on screen, we've got the mobility room, so that'll be maybe low impact again, maybe chair-based. Got the progression room, which is a little bit harder. Then we've got the sweat and the challenge room, which will be quite strenuous workouts. If the client couldn't make the live session, they can go into the vault, and all of our sessions are recorded, and then they can work out a time that suits them. And last but not least, we've got Get Healthy, Get Active. Now, what we were aware of is we didn't want people to come into our service, work with us for 12 weeks, and then as soon as they stop working with us, they're going back to being quite sedentary. We want these to be really sustainable lifestyle changes and being able to continue with that activity. So what Get Healthy, Get Active does is we look at their interests, we look at what's available locally to them, and we try and facilitate access to that. So it might be a walking club, it might be tennis. We've even had a couple of gardening clubs as well for some of our older clients. Now, if they hadn't been to an activity for a long while, or they're a bit nervous about going for the first time, we can actually accompany them for up to 2 sessions just until they feel settled enough to go by themselves, because as I said, we're just trying to take away any barriers that might prevent them from continuing this on. We do want it to be a lifestyle change, not a quick 12-week fix. So I'm going to pass you over to Nick now for the Drink Less pathway.
Thank you, Steph. Okay, yes, so Drink Less is for adults who are drinking more than 14 units of alcohol per week and want to reduce their alcohol consumption. It's worth mentioning that people who are drinking a lot more than the 14 units of alcohol who come into the service will be forward referred onto our partners at We Are With You. This is a programme that is about reduction of alcohol and not necessarily abstinence, although if people would like to go abstinent, then we're welcome. we support them. Okay, so we deliver this pathway through one-to-one sessions. Working with our health coaches, clients can take an in-depth look at their relationship with alcohol and employ behaviour change techniques to make small but significant changes. So what we've seen through lockdown is that over half of people are drinking more. A third of those people are actually using alcohol to help them with stress and anxiety and of course boredom, and even through the gap between the two lockdowns, over 15% of people were still drinking significantly more than they would normally. So as I said, this is about alcohol reduction. We also do workshops as well. So we specialise in craving management, alcohol reduction and mindfulness. So this is really about getting people to employ different coping strategies and becoming more aware of how they use alcohol and the effects that alcohol can have not only on their physical health but on their mental health as well. We have the One You Lincolnshire app, which everyone who signs up to our services can be a part of. So this helps people to track their alcohol intake and their nutrition, hydration and sleep as well. So it's just a friendly reminder that helps them to kind of keep in mind that this is something that they want to achieve. And we also have an online platform that we work with called 1 Year No Beer. We have access to their 28-day challenge passes, and this is support through Facebook forum and daily emails. The challenge aspect of this is that 1 Year No Beer encourage people to look at the different things that they can achieve when they're not drinking. So some people like to sign up to this and maybe promise themselves that by the end of it they're going to be able to complete a 5k or a 10k, and they can also go on to do the 90-day challenges and indeed the 1 year challenges as well. So I'm going to pass you over to Chelsea now, who's going to talk you through our health coaches.
Brilliant, thank you. So alongside our 4 areas of lifestyle support, we do have a team of health coaches who are there for our clients to help them in a holistic way. So what we mean by this is some clients that need that additional support, perhaps they are really motivated to make that change, but they're lacking a little bit of confidence, or, you know, like Steph said, they might not have accessed some groups sometimes, and that's a barrier just getting them to make that lifestyle change. Our team of health coaches are there to support these clients who just need that little bit of extra support there. Now, this could be alongside any of the programmes that they're currently doing, or it could be indeed getting them ready to access a programme. Thank you, Nick.
Brilliant, thank you. Steph?
Sorry, I was just replying to someone in the chat. So
oh,
how do we do it? So once you have referred into us, our triage team will get it in their inbox. We aim to get back to you within sort of 2 weeks. That can take slightly longer or slightly less, depending on how many people we've had triaged in that particular week. But during the phone call, we don't just say, oh, which pathway have you been referred into? Weight loss, great. We look at their confidence, we look at their motivation, their current goals and things like that. And then once they've been assessed, a list of courses come up which we think would be suitable to them. We talk them through it and then they get to decide which one they would like the sound of. If, for example, a client wanted to do all 4 pathways, stop smoking, lose weight, move more, that's quite a lot of changes straight away. It's great that they want to make those, but it's quite a lot. So we perhaps say 1 or 2 rather than taking them all on at the same time. And then at a later date, they can then come into the other ones that they wanted to do. So I'm going to pass you over now to Ali, because stats speak words, don't they? So she's going to explain a bit about our results.
So here we are. This was our first year of operating. So we began in July 2019. So this is up to the end of March 2020. So it wasn't quite a year. It kind of took us 3 months to get recruited and inducted. So we hit the ground running with quite a bit of speed September, October time. And then obviously we all know what happened in March. So we're really proud of these figures. Last year, we helped over 1,400 people set a quit date for stopping smoking. we had 650 nearly adult weight management starters, and you can see the Move More clients were around 430, and we helped over 500 people reduce their alcohol consumption with behaviour change. This is definitely the kind of figures and statistics that we can share with you on a really local level. This is why we're looking to build up the relationships with primary and secondary care, and indeed with the voluntary and the third sector and social prescribers. So please do get in touch with us, because then we can share with you how many referrals you might have made, the pathways that people have accessed, and the support that they've had. Yeah, thank you. Over to Steph.
So how to refer. So some of you might already know this, but I'll explain for those of you who don't. So you can refer via System 1 or EMIS on the referrals form section. When you click into it, it should self-populate with the client's details, and then it's just a matter of ticking which box they, so weight loss, move more, etc., they want to be referred in for. There's a notes section if you want to add any more notes as well, and then you send it through to us. If you haven't got EMIS or System 1, you can access our healthcare professional referral portal via our website. I will post a link in the chat box in a second. And of course, they can self-refer now because the criteria has been relaxed somewhat. I will say though that we tend to get better results when the referrals have come from their healthcare professional, whether that's a nurse, a GP, a physio, whatever, because it kind of gives them the confidence that, you know, it's something that they're supported with rather than trying to do by themselves. So although they can self-refer, which is great, it really does help if you guys still continue to refer into us. So I'm now going to hand over to Nick and Chelsea for some client feedback.
Great, thanks, Steph. So yeah, we wanted to just share with you some of the testimonies that we've had from our clients. We're having some great feedback, and people are very, very happy with the work that we're doing with them, and it's really great to see how we're enabling people to kind of help themselves. So if you are interested in reading some of our client stories, we have lots of stuff on our news site, on our website, so feel free to have a look there and check out our blogs as well. Chelsea's just going to take you through one of our stories.
Thank you. So yeah, as Nick said, this is just one of many stories. I posted the link to our website in the chat there, and if you go to the news section, you'll see a lot more like this. We like to share this one as it really shows the integrated nature of our service, and at the end we had some really good results with this lady as well. So I'll read on from here. So I'd been referred by my GP for lose weight programme. Here I was, a 73-year-old diabetic woman, bored and depressed. Karen, who is one of our health coaches, was easy to talk to, and we soon established a rapport. I felt that she really listened to what I was and wasn't saying, and she made it clear that there was no magic wand. Any changes had to come from me in the first place. The One You Lincolnshire weight management and exercise group was run by Paul, who is another one of our staff members. It was a group of varying ages. Paul made the classes fun, combined with being educational, and was supported by interesting and useful handouts. The exercise part of the class was fun and functional and made me realise that yes, I could do that. It helped ease some of my arthritic problems. After a few months with 1 year, my health coach recommended that I had a medication check with my diabetic nurse. My readings were so improved that I was completely taken off metformin. I'm no longer tired and listless and have actual energy. I'm sleeping well too. And I can't see that last sentence because it's just short of the presentation. But yeah, that's a lovely story from a lady called Jen.
Thanks, Chelsea. Alison.
So here we go, that is it, and that is us. So thank you so much for your time. I know we've got a couple of people leaving already on to their next meetings, but just to really sum up, to be honest, so it used to be a requirement that you needed a long-term health condition, as well as our pathway specific criteria, so the BMI or physical activity. That has now been relaxed, so it is not a requirement that somebody needs to have a long-term health condition. So they would only need the BMI or the levels of inactivity or the alcohol units to be above 14. So just to clarify that. Please, if you'd like us to come and make a more personalised presentation at your surgery, within your team meetings, please do get in touch with us. There are our details. I think a lady called Sally was in touch in the chat. Please do pop us an email or hang around at the end, and we can chat with you about the person that you were talking about. Has anybody got any questions before we launch a little poll? None. The chat's been very busy though. Thank you for that. So hopefully in a minute you'll see a poll pop up on your screen. It's super quick. And we are very much hoping to do more of these in due course. So possibly in January, we were wondering about doing one focusing on obesity and tying in with the Better Health campaign. So please do kind of keep in touch with us. You'll probably get our newsletters now as well. But thank you all so much for your time. And we will send the slides out, Christina. I'm sure we've got your details, I promise. Thank you. Thank you, everyone.
Brilliant. Thank you.